My name is Dr. Sandy Christiansen, and I'm a board-certified obstetrician gynecologist licensed in the state of Maryland and the National Medical Director for CareNet. I also serve as the state representative for the Maryland members of the Christian Medical and Dental Association. Today, I want to get the word out to Maryland voters about an unprecedented challenge to the Constitution of our state. This fall, you will have the opportunity to vote for or against the dangerous Reproductive Freedom Amendment. If voted through, this would permanently alter the Maryland Constitution, making abortion a constitutional right with disastrous results and far-reaching effects. First, even if you believe women should have access to abortion, understand that this amendment is completely unnecessary. Maryland already has among the most permissive abortion laws in the country. Under the 1991 Maryland Freedom of Choice Act, women who live in Maryland have an unlimited statutory right to abortion for any reason through birth. Also, Maryland ranks 4th in the nation for highest per capita abortions, even ahead of California. And girls 16 and older already can get abortions without parental notice or consent. Moreover, abortion providers may waive the parental notice requirement for girls under 16 if they determine she is a mature minor, effectively rendering this requirement meaningless. You know, Maryland is known for our beautiful beaches, our tranquil mountains, and delicious blue crabs. Now we are gaining a new reputation, an abortion destination state. Second, it's important for you to understand the risks associated with abortion and why the need to retain the ability to enact protections through the legislature is so critical. Contrary to pro-choice rhetoric, abortion by drugs is not safer than Tylenol. In fact, the FDA is facing a lawsuit because of their unlawful removal of safety standards around the use of the abortion pills, namely mifepristone and misoprostol, that they originally deemed necessary to protect women. The Supreme Court heard oral arguments on March 26 and will hand down their decision later this year. The abortion pill drugs now account for the majority of all abortions. In Maryland, many women access abortion online through so-called telehealth clinics. The virtual visit often takes place through typed messages with the abortion provider, without any personal evaluation or exam, no requirement to present proof of pregnancy, and an ultrasound is typically not ordered. So her pregnancy is dated by her stated last menstrual period, which is often inaccurate. The abortion drugs are then mailed to her or picked up at the pharmacy. Her home becomes the abortion clinic, and she is on her own. Maryland passed the Abortion Care Access Act in 2022, removing the physician-only requirement, making abortion even less safe by allowing any qualified provider to perform abortions. Note that no definition of who that represents was given. Not only are physicians not required to directly manage women who seek abortion, no ultrasound is required. Without an ultrasound, there's no way to know if she even has a viable pregnancy, or if she's much further along than she thinks, or if she doesn't have a pregnancy in her uterus at all, but has an ectopic pregnancy, which can be life-threatening. All of these unknowns put her at risk for significant complications. I've met women in the clinic who have suffered as a consequence of taking the abortion drugs, and I hear their stories, feeling instant regret, frantic trips to the ER for hemorrhaging, pain, fever, and some even despairing of life itself. Maryland needs the freedom to enact restrictions on abortion to protect women. Women do not benefit from this amendment. In fact, they are harmed because of the protective force field around abortion that would be imposed. Without any checks and balances to abortion, the health of women and girls will be at risk. I also want to point out the vague language in the bill. Individual instead of adult allows for anyone under 18 to get an abortion. The phrase "not limited to pregnancy-associated decisions" allows those under 18 to alter their reproductive anatomy without parental consent. Further, by using person instead of woman, this opens the door to girls and boys seeking body-altering surgery without parental consent. Finally, Maryland is one of only 4 states that compel taxpayers to fund abortion. We pay millions in state Medicaid to reimburse abortion providers and millions more to subsidize the abortion industry and train their workforce. If this constitutional amendment is voted through, no law could be enacted that appears to interfere with the constitutional right to abortion without proving a compelling state interest in costly court battles. Existing laws and protections would be nullified and future pro-life legislative challenges would be blocked, rendering abortion effectively bulletproof. Without any checks and balances to abortion, the health of women and girls would be further at risk. Maryland taxpayers would be forced to fund late-term abortions for women coming from other states at a great cost. Finally, pro-life healthcare professionals, such as myself, could be forced to choose between participation in abortion procedures or losing their license to practice medicine. In closing, amending the Constitution of Maryland actually takes away women's rights because it would stifle laws designed to implement common sense abortion safeguards. Any protocol or procedure to protect patients could be seen as a burden to someone exercising their right to reproductive freedom. Women, girls, and boys in Maryland deserve better health care, not worse. I urge you to spread the word about this harmful amendment and make your voice heard at the polls.